Gentlemen, if you're a man with some unexplained pain or tension down in your pelvis, you may have tense bands of muscle in your pelvic floor. As a men's pelvic floor physiotherapist, if I were to provide you with one tool to help you at home, this would be it. A home release ball. And if you've got it, you've got these two soft inflatable balls that you can pump to your desired firmness. Today, I want to show you how these myofascial release balls can be a game changer for your pelvic pain and learn how to use one over the other.
Step 1 is to grab a chair and place two soft inflatable balls directly on the perineum. This is the spot between the anus and the testicles. If this spot is tender, stay on here and visualize the tension melting away. Try practicing a deep belly breath. As you breathe, you want to feel the pelvic floor gently descend down onto the soft inflatable balls. If it is comfortable, try to move a little bit left, right, up, and down. This is not about digging in hard. It's about telling the nervous system it's safe to let go. Keep it gentle at about a 3 to 5 out of 10, not an intense, I want to stop doing this type of pressure. Perform this for a few minutes at a time. Next, to release the surrounding hip muscles, lie comfortably on your back with your feet flat on the floor and place the firmer ball on your glute muscles. If you hit a bony prominence, this is called your ischial tuberosity, otherwise known as your sit bone. You may feel that if you move towards the middle, closer to the perineal region, this can be quite painful and it may feel like too much pressure. I want you to stay localized to the glute tissue and some of the deeper hip muscles underneath the glute. Visualize relaxing, and again, the tension melting away. As you become more relaxed, try to gently move a little bit left, right, up, and down, feeling for any spots of tension. Again, the pressure should be 3 to 5 out of 10, not intense. Perform for a few minutes at a time. Next, let's go back to using the softball. This time, use only one of them, and this time, cross your leg over your opposite knee if you are able to. This will contract the external rotators of your hip muscles and create more tension in the area. This is why we are using the softball. Roll for a minute or two if the spot is tense. After you feel a softening, this time, move the ball a little bit towards the midline so you're slightly to the left of the bony sit bone. Here, I want you to gently rotate your knee inwards and outwards to release the muscle known as the Obturator Internus. This is a muscle that can be very tight in men with chronic pelvic pain, and it's a muscle that often pulls on the connective tissue of the pelvic floor. For an added release technique, if you have a soft ball that is large in diameter, we can release the Iliopsoas muscle. This is also known as your hip flexor, and it is a common muscle that can be overactive in men with pelvic floor tension. If you have your hands around your waist and feel your pelvic bones, we want to place the ball in the lowest part of the abdomen, and it should be slightly touching the top of the pelvis bones. Visualize relaxing entirely, letting the weight of your abdominal viscera descend onto the ball. Feel for any spots of tension and move left, right, up, and down. Do this on both sides for a few minutes at a time.
Your pelvic floor can get tight for the exact same reason your neck and shoulders can get tight. It's a chronic holding pattern, and we need to learn how to relax these muscles and turn them off. And so to get a full understanding on how your hip can pull on your pelvic floor, I've previously made videos on this topic, along with videos on chronic pelvic pain. If these release techniques are highly sensitive on your pelvic floor and your hip, it is highly likely that your pelvic floor and your system is sensitized. At this stage, we want to focus more on gentle breathing exercises, mindful practices, and gentle stretching at the pelvic floor region. For a 5-minute pelvic floor guided stretching routine, click this video up here to follow along. And as always, check with your doctor to see if these exercises are appropriate for you and ensure you have medical clearance prior to trying anything in this video. Thanks for watching.